Yeah, you can. Good. So good morning, everyone who's here and everyone who's online. Today's CME is about this topic. I hope everyone has had a chance to look at the survey. But I want us just to quickly go through the survey just to give us a clue of basically where we are starting from and to just have in our minds behind this. So ideally, I'd like you guys to fill the survey and return it. The first part is about your primary role, blah, blah, blah. It's supposed to be anonymous, so it's probably best not to fill that because you can probably, if you might be worried that I'll work out from where you work, who you are, but it doesn't matter, but you can leave it. So then the first section is about your role and experience. And then the next is about relationship challenges. So before I describe what the whole idea of this, I just wanted us to think about these things. So I don't necessarily want anybody to answer, but let's just quickly go through them and think amongst them. Think internally about these questions. So the first one, how often do you encounter challenging workplace relationships or interactions in your role? Is it daily? Is it several times a week? Is anyone, okay, I'm going to ask, is there anyone who will answer never? Anyone in the branches who has never had a difficult interaction with somebody? Yeah, so the next one is what kinds of situations? You want to call them issues or challenges, or disagreements, whatever you want to call them. Just, a conversation or interaction that has not gone nice and smooth and friendly and happy. So which ones of these are most frequent? So when you're filling in the questionnaire, please just select 3, but these are the options. So conflicts with colleagues within your section or within your department, challenges with your supervisor or with leadership or management. Nobody's looking at me. Tensions with clinicians, physicians, either on the phone or when they come here looking for something. Challenges with nursing staff. Issues with the lab colleagues in other sections, that's the same as the first one. Problems with support staff or admin personnel, whether it's inside the lab or outside the lab. And then challenges with patients. It says here specimen collection staff. That's generally us, but of course sometimes specimens can come from outside. Then the next one is asking for you to rank the following challenges based on how frequently they occur. 1 being the most and 7 being the least. So here, this is really kind of trying to categorize the type of challenges. So communication breakdown, personality clashes, workload or resource distribution issues, disagreements about procedures or protocols, issues to do with authority. Are you comfortable with somebody having given you an instruction or asked you to do something? Or difficulty with an interaction just because somebody is senior to you, that in itself can make an interaction a problem. Or maybe there's something you want to say and you're not comfortable. Yeah. And then coordination problems between departments. And then this is a very vague, broad, but important one. Stress-related negative interactions. Yeah. So then the other parts will be it says, please describe a specific challenging interaction. Again, just think of one. Don't necessarily need you to write it out, but just be thinking about specific. The other parts are basically about, okay, actually we can look at the first three. How confident do you feel in your ability to effectively manage these kind of situations? Okay, so now this is the part of, we've thought about when these things happen, how they happen, who they happen with, blah, blah, blah. But now how comfortable are we with managing? Anybody want to answer that they're very confident? No? Leslie's laughing because I was looking at her. Anybody who want to answer not at all confident? Huh? Somewhat, okay. It would be interesting to actually see where people feel that they are, for us to all know where people feel that they are. So once people respond to this, maybe we'll just compile and see, are most people sitting in a very confident or in a not confident at all? Have you thought about ways of managing these situations? Sometimes you just do it naturally, but have you actively thought about what strategies, what mechanisms, what ways you are using to consciously handle such situations? Because they don't happen only once. And sometimes they can happen more frequently with specific individuals. So sometimes you start to develop your own coping strategies, right? So what strategies do you use? Direct conversation, seeking support, which I know some people think is reporting, but it doesn't have to be reporting. You're just trying to resolve a situation. Being accommodating to the other person, trying to find a compromise, documenting things, and other strategies that you might employ. Bringing forward your leave. If you've had a difficult interaction, I've had that situation where I knew I was going to go on leave in a month's time, and I thought, let me take it now. And then the last part is about specific skills that you most like to develop, but discuss. So now that we've thought about those things, we can move to the presentation. So just to say that the idea I have, and we've discussed with Victor and Amos, is this is supposed to be just an initial presentation. I'd like it to be a bit interactive if possible, but what we'd like to do is to then have further sessions, whether it's more presentations, whether it's kind of like a workshop situation where we try and use some of these techniques. We can think about those different options. And that's part of what the survey is supposed to help us make a decision on, is what's the best way to now the further session. All right. So there'll be some parts of the presentation which assume that this is the first of 3 sessions, but that is not definite. So this is that slide. It talks about course objectives. The idea is to try and improve our understanding of how we interact with each other, relationship dynamics. Importantly, to learn conflict resolution techniques. And if anybody knows about these things, you know that this is not something you can do in a 45-minute CME or even 2 or 3. Okay? And that's really the ultimate goal. Yeah. So this is the course overview. The idea is to have a theory, then practical, but we'll see how it goes. So I don't know if you can read. I don't know if there's a way of making this a bit bigger. Anyway, what that says Yeah. Conflict is inevitable, but combat is optional. Does anyone disagree with that? At least the first part. Yeah, even as you just thought of situations that you've encountered. Are there any of them that you think you can get to a situation where that can never happen? Yeah, there's always going to be situations where there's conflict, but it doesn't have to develop into a fight. So just think about why in the lab conflict is always going to happen. What makes conflict in the lab? What generates conflict? What kind of situations? This is the first point, and I'll maybe I can ask. Time-sensitive or high-stakes decisions. Wafula, a situation that a conflict has arisen that kind of would fall into this category. A conflict that you might have experienced. I'm thinking of specific ones. So, yes, exactly. Yeah. So they need that response. They need the blood, right? And sometimes they'll tell you, "I need this blood now," and then you find that actually, if you look at our protocols and what kind of situation you need to give the blood in, is the HB low enough? Is it really a critical situation? But anyway, so there's that time critical part. And then the high stakes, they're saying that the patient is bleeding out. Critical values, all these kind of things. That's very common. As in, it's so common that we have an SOP for critical values, right? Yeah, so these situations, they're happening all the time. We've a couple. But the next one, miscommunication can impact a diagnosis. Cynthia, again, that's why we have critical value protocols. Yeah, specifically the part about reading back. But I know that every one of us can think of a situation where there was a piece of information that didn't quite get communicated fully to the other person. Yeah, handover. How often do we have issues and it was handed over, but it wasn't done, or it wasn't handed over? Yeah, by nature of the fact that we work shifts, there's information that it's not that every case that you handle, you'll finish it very quickly. Like let's say you're working in a shop, someone comes to buy something, they've come to the counter, they've paid for it, you bought, they've gone. When the next person is coming on shift, you're not going to change shift in the middle of an interaction with a client. Yeah. So in other environments, this issue of handover is not necessary. It doesn't come into play, but it's critical for us, and that's one of the big successes I feel that for those of us who have been here for long enough, that we didn't used to do effective handovers. But now if handovers, as far as I'm concerned, are extremely effective. Yeah. They're not perfect, but perfection is impossible. So now, people dynamics often fall short. This is very nice soft language. It's basically saying that nobody's perfect. Yeah. And so you yourself, maybe one day you'll be having a bad day, and you know you're having a bad day, and something irritates you, so you lose your temper. You lose your temper with somebody who has nothing to do with why you're having a bad day, right? I'm sure you've also experienced it on the other side. You're just going about your normal business, and then suddenly somebody is shouting at you, and you don't. And then there's sometimes just the way that we relate with each other interpersonally. Yeah. Sometimes there are some people who just rub you the wrong way. Similar. Unfortunately, when you're working, if it's somebody that you're working with, it's a situation that has to be handled. You know? If in your personal life, if someone is, forgive my language, pissing you off, there's a friend who constantly pisses you off. So you just say, me, I don't have to deal with this person. Yeah? Okay. Have you ever cut off any friends, former friends, because of their behavior? Yeah. Or maybe just how, you just like, because the stakes there are low. It's like, what will happen if I don't keep talking to this person? I'll have an easier life, and that's it. But we can't do that in work because we have to be interacting with these people all the time. And then we've talked about the environment that we're working in, time-sensitive, high-stake decision. We're talking about diagnoses. We're talking about patients being treated or not treated, and so on and so forth. And then we're talking about pressure that often comes from situations that are not really to do with the stakes for the patient, but the stakes for the organization. Yeah? TAT challenges. We are under pressure to maintain TATs because if our TATs are bad, patients won't come, they'll go somewhere else. Yeah? OS. Yeah, it generates a lot of pressure. And if you're operating under pressure, yeah, it does not lead to a very to having very relaxed relationships. Yeah, you're more likely to be in that bad mood because of some issue that has come up, which means that I don't know, Jacqueline, you're trying to find gloves to distribute. You can't. Wear OS. You talk to somebody. We've had a bad interaction with whoever that person was. Then I don't know. I walk past you. You look at me badly. Or I see the way that you're looking, and I think you've looked at me badly. I'm like, Allah, what have I done to Jacqueline? Nothing to do with me. Yeah. So now suddenly I'm thinking, hey, I've done something to Jacqueline. Yeah. And actually, a very good example. I remember the feedback that I got from you about the way that I interact with people on a daily basis. Yeah. I will just come in with my head down, go into my office, close the door. And then the only time you hear from me is when there's a problem. I come out. What happened? Fine. Yeah. I haven't even asked how you are. I don't know whether you are feeling unwell. I don't know if there are any issues, blah, blah, blah. But now, because that's the way I was behaving, when I come out angry, you think I'm angry at you. What you don't know is I've just had a conversation with somebody on the phone. Or I don't know, I've got a stomach ache, or I've had a fight with my wife, But if you don't have like a good baseline of interactions, then these relationships start to become strained because everyone is on edge. So impact of strained relationships. If you're not if you're not talking to somebody freely and happily and whatever, or you've decided, if I talk to this person, I'm going to lose my temper, then you don't hand over effectively. If you're stressed, you forget something. There was something you knew you were supposed to hand over, but because of the stress and the pressure, yeah, you're in the middle of doing 3-5 different things and you are still having to hand over, you miss stuff. Yeah. Ever happened to you? Okay. You ever missed to pass something on because you forgot? And if the answer is no, say yes, because nobody's going to believe you. Oh. Yeah. Yeah. We've all had it, right? And it's not because there's something wrong with you, it's because you're a human being. Yeah. Uh, um, it can lead to friction when you're having these problems with managing relationships between each other, but it can go beyond that. Yeah. I wish Amos was here. I wanted him to tell us a story of a window, a knife, and a policeman. Does anyone know that story? Was anyone here when that happened? No one? Victor. Amos, can you hear us? Anyway, obviously that's an extreme, but my understanding, I don't know the nitty-gritties of the details, but there was a conflict between an individual and I don't know if it was one person or several people. I think that individual had various issues, but they came out in an interpersonal conflict with somebody else in the lab. It involved a weapon being brandished. Thankfully, it wasn't used, I don't think. No, it wasn't used. But the window part is apparently that when the person was, it was that one. Yeah. But now that person who was having issues with people was kind of, I don't want to say cornered, but when they were challenged, they escaped through the window. Yeah. If we were accredited at that time, see, that's an NC. Yeah. That's probably using Victor. That's not a recognized method of exiting the lab. We jump through the window. Yeah. It's an emergency, but the reason for at the time it wasn't an emergency. So maybe that anyway. But the point is that that's an extreme. But we've had other situations that we have experienced, I know, where people have behaved in a very unprofessional manner. Yeah. Sometimes it's people outside behaving towards us that way. But sometimes even we have behaved in a professional manner. Yeah. And it's because you're under stress. Senior. Most people who are behaving unprofessionally, in most cases, it's not because they're an unprofessional person. It's not because of a character flaw. Yeah, it's because they've been pushed by the situation that they're in, and you become disinhibited. The way you know how alcohol disinhibits you, other drugs disinhibit you. Pressure can also disinhibit you and stop you from following those social rules, professional rules that you know you're doing. And I'm sure if you know anybody who has behaved unprofessionally well enough to go and ask them about what happened, they'll probably tell you, me, I can't even tell you what happened. Yeah, it's like, it was like a cloud came in my head or something happened. People talk about seeing red. Yeah. Yeah, so people become overcome by this, and then it leads to. And of course, in the middle between the extreme of unprofessional behavior and the milder, reduced effectiveness of handover, we have just the general issue of unnecessary conflicts. Yeah. And the final result is, if we're always going to be exposed to stress, right? See, we've decided, we've agreed by the nature of the work that we do, we know that we can expect every week you're going to encounter stressful situations. It's part of the job. It's not in your job description, but it's in your job description. It's in your, yeah, by the nature of the things that you do. Yeah. The part where you're being exposed to, unprofessional behavior and all that aside, just by the very nature of the fact that you're working in a lab, time sensitive, high stakes, diagnosis, blah, 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 means that you're going to be exposed to stress and pressure. Yeah. So if you're not able to punguza that stress, to either reduce the stress itself or to reduce the impact of that stress, we all know what happens with stress-related health conditions, right? And it's a very real thing. People develop high blood pressure. People develop psychological issues. Yeah. People end up quitting a job because they can't handle the stress. Yeah. So that's kind of the be all and end all of all of these things. Yeah. If we don't manage relationships, it causes all sorts of complications. But the worst thing it does is it impacts on our health. So technical skills and the technical work that we do rather, it basically means that you process your samples, you release your results. That's the technical part. You do your QCs, you do whatever, but But for all of those aspects to function smoothly, safely, and sustainably, we have to pay attention to the way that we relate to each other because we're not machines. So I hope I've convinced you that it's important to address these things. Yeah. So I think this is a few examples of which I already mentioned: communication breakdowns, interdepartmental conflicts, managing clinical team expectations. That's just this issue of TATs and whatever. Yeah. Sometimes people have very unrealistic expectations. They don't understand. Occasionally you find someone who doesn't care or says they don't care. Yeah, but sometimes there are assumptions that people make about what is possible. Yeah. Who has heard someone say, but in Aga Khan we can get a hemogram in 10 minutes? You've had that. Yeah. But in, I don't know, if I go to Coptic, I can donate blood whatever time of the night I want. Yeah. But when I do a shift in, I don't know, Mater Hospital, it's the lab techs who take the blood, it's not the nurses. Yeah. So people have these expectations of you, and we need them to understand, fine, that's what your expectations are for elsewhere, but unfortunately, for the reasons X, Y, Z, that may not be possible. We've talked about this briefly, hierarchy issues. Actually, we haven't really talked about that, but I mentioned it when you say that sometimes, just the fact that somebody is senior to you, especially the more senior they get, it is creates a tension, a challenge, just by that virtue. Yeah. Carol, that you're not going to have the same kind of conversation with Wafula that you're going to have with Amos, or me, or Dr. AK, or Dr. DK, right? And even the conversation you have with Dr. AK and Dr. DK might be a bit different, just because of that, the difference in that you find yourself in that hierarchy, right? In the same way, I may not necessarily talk to you, Carol, the same way I'll talk to Amos. Yeah. I hope I'll still be polite to both of you, yeah, and professional to both of you. But the way I'll have a discussion with Amos about something that needs to be done is going to be different from the way I have that conversation with you, right? So sometimes that brings issues, yeah? And there are issues with expectations. So the expectation of the person who is higher up in the hierarchy, but also the expectation of you who is lower down in the hierarchy, yeah? Sometimes we make assumptions about what this person wants or needs or is looking for. Yeah, and because of the fact that there is that gap in our hierarchy, it's difficult to, like now, Carol, if I ask you to do something, you'll say, do you mean this way or do you mean that way? But if DK calls you and tells you do this, you may not feel quite so comfortable saying, do you mean this or do you mean that? Which means that you cannot then clarify what exactly is expected of you, right? So again, that immediately makes the interaction tense, because now it's like, now what am I supposed to do? How am I supposed to handle this situation? Okay. That's kind of repetition. Right, so that's kind of setting the scene. Now we want to talk about how people respond to conflict, okay? Remember, this session is supposed to be about theory. Okay, so we're going to discuss a little bit of theory, just a way of thinking about these things. So understanding how other people respond can help to reduce assumptions and miscommunications. Yeah, that example I've just given you of somebody who is very senior, and you are you have to make assumptions about what they need because you can't question them. But if we start to understand how others respond in certain situations or to different situations, it can help us to start reducing the assumptions that we're making about what's going on in this interaction. Yeah. And it's not only when it's up and down the hierarchy, even with your colleagues. Yeah. If you're, I've been mentioning stuff on people. If Muthoni and Brenda, yeah, because you guys, you live and share the agents and whatever, yeah. If you understand better how Muthoni tends to respond in certain situations, it might mean that she might say something which you might have assumed meant A, but actually she meant B, and vice versa. Okay, and we can all think of situations where that comes through. It's also important to understand how you respond to difficult or challenging situations, or to stress in general, right? When you come up to a situation where there's what's the best word to use? Should we call it an issue? When there's an issue, all right? The way you respond when an issue comes up, it's very important for you to also understand how do you tend to respond to these things? Because that can also, when you just start thinking about that, it's the first step to helping you actually try and manage how you tend to respond, right? So, and if you don't think about it, you may not recognize the way that you tend to respond. Yeah. I don't know if Joyce, are you on the call? Is Joyce there? She's not there. I think she'll allow me to tell this incident. So there was a time, I can't remember how long ago it was, but I've been here for at least, I think, a couple of years. And don't laugh about what I'm about to say, because I'm very serious. I thought that I am a very calm, collected, soft, composed person who never demonstrates emotions, at least negative emotions, because I'm not that person who loses their temper and shouts at people. That's not me. It's never been me.
Doc, I'm around. You can go ahead.
Joyce comes and says, Doc, Joyce is around. Joyce, are you there?
Yes, I'm around. I don't know if you can hear
I'm
me.
assuming the permission for telling this story.
Yes, you have. Go ahead.
So Joyce came and said to me, Doc, I can't remember what it was that she needed me to know. She said, Doc, I want to tell you something, but please don't get angry. I was like, why would I get angry? I never get angry. But then I looked at Joyce and I know that Joyce usually speaks the truth. Sometimes she'll tell people things that other people won't be happy to tell them or comfortable telling them. Yeah? And then I realized there's an issue here. Internally, I'm encountering situations where I feel frustrated and angry. I think I'm handling myself. I think I'm controlling myself. I think I'm behaving appropriately. But the experience for the person who is in the room, hopefully not in the next room, but in the same room, yeah, could be very different. So that kind of reflection or just understanding, in certain situations, I tend to respond this way. And that causes issues. So theory. There are various theories that people have come up with, but there's this idea of the fact that people tend to respond to conflict in different ways. And this is one that I'm just going to show you now. Okay. So it doesn't matter that it's called the Thomas Kilmann conflict model, like fancy things, that's what it's called. Let's try again, can we make this bigger? So the idea is that, according to one person, there are 5 different ways that people tend to respond. You tend to fall into one of these. So the first one is, I can't even read it myself. Let me read from my screen. The first one is competing. So the idea in competing is that you're basically, when you have a situation where you have an issue, a conversation or an interaction that's an issue, the way that you approach it is to say, I have to win. Somebody is going to win, and I don't want it to be me who loses. Yeah. So this is how I'm going to handle this conflict. I'm going to make sure I win, and the other person loses. Right? It's a competition. Coming down to avoiding. Yeah. By the way, as we talk about each of these, let's ask yourself: is this you? Is this me? Yeah. Avoiding. A conflict arises, an issue arises, and it's like, I don't know what to do. Let me just avoid, let me just walk away. Yeah. Let me just pretend it didn't happen. And let me also, because this issue is coming, a particular person, let me avoid talking to that person. Let me avoid working with that person. Yeah. Because it's easier. It's okay. Yeah. Slightly more legible. I can zoom myself. Okay. Then there is the person who is accommodating. And it's like, you had a thing, you had an issue with somebody, and you just say, it's okay. Let me just comply. Let me accommodate. Yeah. I think I'm right and the other person is wrong, but I'll just move out of the way and accommodate. I'm not avoiding, but I'm just accepting that, you do it their way. Then top right there is collaborating. Yeah. And these two, competing and collaborating, they're kind of opposites. Yeah. We've all heard of win-win and win-lose situations, right? Well, you know what I mean by win-win and win-lose. Yeah. So the idea is that it's exactly this part of competing. Even in, let's say, in a negotiation, yeah, you are out somewhere buying vegetables. You're trying to negotiate the price. So you're buying a car, whatever it is that you're buying. Yeah? There are some interactions, some of those negotiations where each person is trying to win. Yeah. Each person is trying, the person who's buying wants to get the lowest price possible, and they don't care about whether the other person is making a loss. And the one who is selling wants to sell at the highest possible price. Yeah, they don't care whether the customer can afford. So if those two people have those attitudes, are they going to be able to agree? Most likely not. But if they're both thinking, I can win something with the other person also winning. So the other person, me, I'm buying. If I can buy at a price that I can accept, person who's selling and still make a margin that allows them to keep the business going, then that's better than me walking away not having bought anything, because I need what they have. And the seller is, if I can either lose the sale or I can make a smaller margin. But the way that you enter into that interaction is will determine how that interaction is, how that negotiation is going to be. Yeah. So if you have a mindset, if in your brain you're always thinking win, 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 it's me to win and everybody else to lose, then your outcome is going to be different than if you're going into interaction saying, how can we win? Yeah. And then the one in the middle is compromising. Yeah. And there's some sort of elements of each of them that go into the compromising part. So the point of this theory is that it's kind of saying that there are two components. There's assertiveness. The bottom is less assertive, and the top is most assertive. So are you an assertive person? Yeah. Are you the kind of person who stand your ground and walk forward in you have an issue or conflict? Or are you the kind of person who wants to withdraw, be less assertive? And then this other axis, you have cooperation. Less cooperative, more cooperative. Are you the kind of person who is like, it's my way or the highway? Or are you more cooperative? It's like the other extreme. We all have to agree. Everybody, if you're going to take a vote, it has to be unanimous. Yeah? So that's kind of the framework that this model is supposed to use. But that's not really important. The point is that we generally, the idea is that generally most people fit into one of these categories. Yeah. And it's important, it's useful to think about it because you may feel that you're in one, but actually you're in another. So maybe as you answer for yourself, which group are you in? You can also discuss with somebody who knows you well and who you trust and ask them to tell you which one do you think that you're in. Yeah. You might think that you're a very collaborative person. And then your colleagues telling you no. They're not at all. Yeah. So now these conflict styles, they apply to each individual, right? And everyone cannot be the same. Yeah. So if you have somebody who has a competing style and they're trying to work with somebody who is having a collaborating style, generally those interactions are kind of going to, they'll tend to go in one way. If you have two people who are competing, what's going to happen? Is that going to be resolved quickly? Very unlikely, right? So why is it important to think about these things? And the first thing is that we all know situations where such issues have come up. And what do? We react rather than respond. Yes. Something happens, it makes you feel angry, you react angrily. Yeah. Celestine, have you ever reacted angrily? I think you're wrong in a part of every time. Yeah? Almost every time. And the time that you're not reacting, you're taking a bit of time, you're taking a bit of breath, and you're asking yourself, how am I going to respond? How am I going to reply? What am I going to do? Rather than just, I've done it, it's done, I've reacted. Yeah. And to be able to recognize that difference and start responding rather than reacting, it's helpful to understand conflict styles. Sorry, the text is a bit small, so I can zoom it again. The second part is that we've said that conflict is always going to happen, right? There's always going to be situations where maybe we should have started by defining conflict. Does anyone want to say what conflict means? Victor, how would you describe or define conflict?
Typical environment only the this kind of disagreement.
Okay, yeah, disagreement.
One party and the other they have different view.
Yes, yeah. It's basically unless you have an identical twin, right? Unless you have an identical twin, the way that you perceive a certain situation, your understanding of a certain situation is almost certainly going to, sorry, unless you're an identical twin, it will always be different from one person to another, right? Wafula, you'll be sitting next to you, right? You've been sitting on the bench side by side for an hour and something has happened and you've both observed it. Yeah. But if now somebody asks you what happened, the way that you have perceived it and the way that you understood it and the way that you'll explain it is going to be different to the way Wafula did. Right? Just purely by virtue of just by virtue of the fact that you're two different people means that you're going to see things differently. And anytime that you see things differently, that can lead to a conflict. Disagreement, not necessarily that you are fighting, but you just don't have the same opinion, exactly the same opinion about something. Right? So when such situations arise, because they're always going to arise, you can either handle them in a constructive fashion. Sometimes you can even use them to advantage. They can actually be positive benefits that arise from sorry, we've lost power for a second, but it's coming back up. So just give us a second. Ah, good. Yeah, okay. Is it? Oh, we need to share. So let me just quickly reshare. As I'm doing that, I've just seen a message from Ambrose Inyeri about challenges attending the CME. Understood. It's being recorded, so you'll be able to review it later. We'll share that on the group as well. So. Sorry. So for some reason, we can't see the images, but I don't think anymore, so we'll probably be okay. So yeah, so we're saying that rather than just reacting in a situation, we might actually be able to take control of that conflict situation and actually get a positive outcome out of what would otherwise be negative. It's also important to understand conflict styles because it can help to protect team cohesion. So key benefits. The first one is that part of self-awareness that we've been talking about, right? So rather than reacting automatically to a situation, we are being considered and intentional in how we respond, which means that the outcome of that interaction is going to be better. The second is adaptability, because if you understand how different people respond, you can also adapt how you respond to or interact with that person based on what their usual style is. Yeah. If you know you're dealing with somebody who is, you're going to handle that interaction differently to somebody who is very cooperative or collaborative. So yeah, or compromising. So once you start to recognize that this person responds this way, then you can you can modify how you relate to them so that you increase the chances of that conflict being resolved in a good way. Team dynamics and reducing misinterpretation of intent. If you understand that somebody's way of responding in pressure situations is to be avoidant, right? And by the way, there's not necessarily any value attached. We're not saying that one response style is better than the other one. Not necessarily, okay? So we're not saying because you're a competitor, you're a bad person, and because you're a collaborator, you're a good person, right? We're not saying that. We're just saying that people tend to respond in certain ways. And if you understand that somebody tends to respond in, let's say, an avoidant fashion, when you're talking to somebody and it's a bit tense and they walk away, you could think this person is so rude. They can't even talk to me. Whereas actually this person is thinking, maybe if I stay in this situation, maybe the person who is avoidant because they know that they have issues with their temper, let's say. They know that if they continue in this stressful situation, they might start behaving unprofessionally. So in order to manage the situation, they've decided, let me walk away, and then we'll come back and deal with it later. Yeah. So you, as the person who's observing this behavior, you can either see it as somebody being rude, or you can see it as somebody actually being helpful because they don't want a bad interaction, right? So understanding how other people respond to stressful situations is very helpful for you to be able to understand better why they're doing what they're doing. It's not necessarily because they have an issue with you. Yeah. It could be for all sorts of other reasons. And hopefully the ultimate outcome is we preserve relationships, we protect relationships, we even improve relationships, we reduce tension, blood pressures go down, your dose for antihypertensives is reduced, so your bill for drugs this month is lower. Yeah. So that's the idea. And then it has kind of benefits that are outside just managing relationships with your workmates, right? Because this part of being able to modify how you respond to such a situation, being able to understand better how somebody is responding, why they're responding the way that they are, and being able to therefore, improve the way that you relate to them is a key component of this thing that we call emotional. And some of the important parts of emotional intelligence are to be empathic, to communicate better, and to be able to strategize. Yeah. So empathy just means being able to put yourself in somebody else's shoes to understand where they're coming from. Right? And that's not only going to help you in your work relationships. It's going to help you in your business. It's going to help you at home. It's going to help you in church. It's going to help you in all sorts of situations. Yeah. So this issue of understanding ourselves and how we respond is very important. So the next part is to talk about this kind of way of thinking about challenges that arise in the lab. And that's the difference between having challenges that are technical and challenges that are adaptive. So the idea here is, let's say you're doing a root cause analysis. Something went wrong. There was an NC, you're doing a root cause analysis, right? And you're trying to figure out what went wrong. Yeah. Generally, your root causes are going to fall into two categories. One is going to be a very technical one. Yeah. There was a QC failure. The equipment went down. We didn't have our integration cables faulty. Technical challenges. Even the SOP doesn't cover the situation. Not the SOP was not followed. The SOP does not cover this situation. Technical. So the resolution for a technical problem is a technical answer. Yeah? So it could be there's a problem with the machine, fix the machine or replace the machine, right? So these kind of problems tend to be very clearly defined. They're usually existing solutions or protocols, or if they're not, it's usually quite straightforward to fix them. And they're fixed by somebody who has the appropriate knowledge. That's all expert means, is that you have the appropriate knowledge for that specific situation. But then there are a different class of situations that arise, which in this framework they're called adaptive, which are more or less technical, let's say. For example, improving communication, right? So maybe the reason that something went wrong on one of your root causes was ineffective handover, right? With ineffective handover, there's nothing that's broken that you can place or fix. Yeah, it's like a process that didn't go right. But in that ineffective handover, if you start asking yourself, okay, why was that handover ineffective? Then we're going back to all the things that we've just been discussing. Yeah. Yeah, it could be because of the way that people who are handing over to each other, there's a challenge in how they're relating that has led to that ineffective handover. And solving such challenges, as I said, you can't fix it by replacing a part. And you can't also fix it by replacing a person. Yeah. Unless it's at that extreme situation we talked about where someone is jumping out of the window with a knife. You know, sometimes that's an irredeemable situation. And it might be better that that person is no longer working here and somebody came to replace them. But that's very extreme. Yeah. So sacking somebody because of ineffective handover, how is that appropriate? It can't be. So solving them, such issues, usually require a shift in attitudes. Yeah. And they're usually solved through collaboration. Now, the challenge that we have in the lab and in any other sort of workplace, but particularly in lab because we have so much technical work that we do, we assume that a challenge, the issue that happened, the root cause was a technical one, whereas actually it was an adaptive one. So we've decided we are going to change the protocol. We're going to put in a new protocol. We're going to maybe train, because even technical challenges might include knowledge. Yeah, someone didn't know how to do something, so you teach them how to do it. Yeah. And thinking about it, we've had this issue that has been raised many times before. Yeah, there are certain non-conformities that always keep coming up. And we do a root cause, we implement the changes, and then they keep recurring. And perhaps this is one of the reasons that we are having that issue, because maybe we are ascribing technical reasons for something not working, and therefore employing technical solutions when actually they are more adaptive. So the comment at the bottom there is to say, behind every challenging behavior is an unmet need or concern. So this is kind of a new concept, right? But we've touched on it before, where we're saying that the way that somebody is responding may not be why you think they're responding that way. Yeah. But if you go back to what we're saying about being in stressful situations, most of the time when somebody has lost their temper or is angry or is in a rush or is pressuring you or is annoyed or whatever, there's usually a reason, and often you don't know what that reason is. Yeah, but it's something that is disturbing this person. There's a need that they have that hasn't been fulfilled. There's a worry that they have that hasn't been addressed. And they may not be telling you precisely what that is. And as we said before, it might be a situation where you're not in a position to make inquiries to find out what's really disturbing this person, what's really bothering you, so that I can help to fix that. Yeah, but it's an important thing to recognize, in the same way that understanding that people's response to conflict is different. And if you understand how they tend to respond, you make fewer assumptions or less inaccurate assumptions. Again, just remembering that if somebody is at an extreme in terms of their response, there's something that's disturbing them. Yeah? There's a need that they have. It's not necessarily that I have a problem with you, that's why I'm angry. Yes? Again, somebody else who's not here. Rose, I don't know if Rose is online, but you can ask her later. There was a situation where I was talking to her. I took a phone call or made a phone call. I was mad, not at her, but the information that she had given me and the phone call that I had, I was close to losing it, right? Thankfully for her, she experienced the whole thing. So she saw me happy, she tells me something, I react, she knows why I'm reacting that way, and she knows that I'm not reacting at her. But what if she had just seen the reaction without the lead up to it? She might very well assume that I'm angry at her. Yeah. So you see somebody who is, pushed to that point where they're responding in an extreme way. There's usually a justification, or rather a reason for why they're responding that way, which is not necessarily something to do with it. And that reason does not justify that behavior. But at least you can say, this guy got mad. He shouldn't be getting mad, but at least I know he's not mad because of it. So that now when you're responding to them, you're not, terrified of this person. You don't want to run away from them. You might be more thinking, okay, what's up? What can I do? How can I help? So there's one more kind of theoretical part, and I'll go a bit more quickly through this. Actually, you know what? I'm going to skip this because I think we can discuss it another time. But it's basically a concept about how you can interact with each other to resolve conflicts, right? So I won't go through in detail, but the point is that rather than I'm coming to you, Afula, and I'm telling you, why haven't you done this? And you're thinking, hey, look, he's angry at me again, like he always is. So you're like, let me just wait for him to calm down, and then maybe we can discuss it. But an alternative would be to say, Doc, what's bothering you? What's the issue that you're trying to solve? So asking this question, help me understand, why is this important to you? And having that question in your mind can be helpful with your colleagues. It can be helpful with clients, with patients who are upset, donors, whatever. Yeah, rather than just reacting to the fact that they've lost their temper. If you start by thinking, okay, why? And you'll often find that by asking that question, it quickly will reduce the tension. Okay? This is a slide about emotional intelligence, which is usually abbreviated to EQ in the same way that IQ is for intelligence. So the components EQ, for EQ, the self-awareness, self-regulation, motivation, empathy, and social skills. Okay, so these are important things to work on and try to develop as a component, a mechanism for us being able to manage our interactions with each other better. So again, these actually we'll just spend a little bit of time on this. I want you to think, look at each one, and okay, let's look at the first one, the non-communicative colleague. By a show of hands, and you, just those in the room, have you ever worked, I'm not going to ask about here, have you ever worked with somebody who would be described as a non-communicative colleague? Yeah? You're not showing your hands, but you're nodding. So I'm seeing 2 nods. Yeah? That person who, they just don't talk. So you don't know what's going on with them. Yeah? And sometimes they explode. And you have no idea why. Yeah? The demanding clinician, I won't even ask about. The territorial specialist. That's that person who, these are my things. Don't come anywhere near my things or my work. Yeah, that's not, it's nothing to do with you. Leave it with me. The perfectionist. And by the way, consider whether you are that person yourself. In fact, I should have said, if you can't think of anybody who fits any of these categories, maybe that person is you, right? If you can't think of someone who's non-communicative, maybe it's you. Yeah. The perfectionist, that person who, if anything is even slightly wrong, there's an issue. The veteran who is resistant to change. The micromanager. For those online, I would like to report that there are some people here who are laughing very quietly and not putting their hands down. Yeah, because we all know people who fit into these categories. And people can fit into more than one category, by the way. I know that personally, I fit into at least 2 of these. And depending on the time of day or the day of the week, maybe more, right? So these are all situations that we encounter. Again, you might remember that behind every challenging behavior is an unmet need of concern. So that magic question, what is bothering you? How can I help you? So we're coming towards the end now. Rather than why understand conflict styles, is what do we do? So what should we be doing? We should be trying to respond intentionally. Yes, we are trying to not react to a situation. Yes, you're angry. Yes, you're frustrated. Maybe you're even depressed. Just today, you're like, yeah, I don't want to handle this. Yeah. But choose conscious responses and make those conscious responses positive. So don't consciously decide your way. Yeah. Be adaptable. Match your response to the context, to the other person's style that you know, the situation that has arisen rather. Yeah. Be adaptable. In order for team dynamics to work, be aware that it's very easy to misinterpret somebody's intent. Yeah. We all have situations where we are like, I know the reason that this person did this is because of this. If you ask yourself, how do you know? I just know. If that's your answer, maybe you may have misinterpreted. You might be right, but maybe you're not. And if you make that is a misinterpretation and act on the misinterpretation, that's going to make things worse, not better. And just aim for better outcomes. If you're feeling that there is tension, think to yourself, how can I de-escalate this tension? Yeah. If you're having an issue with somebody today, ask yourself, do I handle this situation in a way that's going to make things worse between me and this person? Or do I handle it in a way that's going to preserve the relationship or even improve that? But if you're thinking actively, intentionally about these things, we're not able to do that. Okay? And remember those components of emotional intelligence. Developing emotional intelligence is a whole subject in itself. I don't know if anybody has looked into it themselves. There are places you can go and online and you do a test and it tells you what your emotional intelligence quotient is. Again, I remember doing it once and thinking, me, I know I'm very emotionally intelligent. Only to realize that I have an inflated sense of my own EQ. So it's a whole thing, and it's something that we can all work on ourselves, but we can also discuss it in further sessions. So these are examples that were there, which I won't go through because of time. Maybe we can go through these in a different session. But these are supposed to be practical scenarios that you just think about and consider how one might develop a response rather than a reaction. So just very quickly, let's look at this one. The emergency department sends an incomplete requisition for a critical test. Each person is going to have a different perspective. The lab tech needs complete information. Yeah, you have a sample collection manual, you have a specimen rejection form. You need to follow those SOPs because if you don't, there are issues with accuracy. The nurse, she's thinking this patient is getting worse. Where is that result? Now you're telling me, I don't know, I didn't put the middle name or what. Yeah? The patient is thinking they're dying. Yeah, and then the supervisor is focused on ensuring quality, TAT, blah, blah, blah. Yeah. So everybody has a different perspective. But now if you're only thinking about yours and you're not considering everybody else's, the chances of this conflict situation going badly are much higher. Okay, so that's basically what I wanted to discuss today. The next couple of slides were basically planned for what we can do in further sessions. So this is what we could do, which is to have kind of a workshop where we are discussing practical skills, going into more details of these last couple of slides that I've looked at, and discussing cases. Yeah, we can discuss them in groups, or you can discuss them amongst yourselves using some of these ideas. There is a self-assessment thing that you can do to help you to determine what your conflict style is. So I can also share that for people to fill in so that you know what you think your style is, but if you fill in this self-assessment, it can actually tell you based on how you respond to certain situations, what your action style is more. So the key takeaways from this session: relationships at work require intentional effort. That'll do. That's a good takeaway, right? to be able to relate well with each other, you can't just show up and just, deal with things as they come. We need to make effort, and we need to be intentional to get things to work better. And the outcomes that we described, the results are all for our own benefit. So it's 10 o'clock. Any questions or comments?
I think the document titled on top.
Yeah.
It's supposed to be.
Yes, please.
Not able to.
Or you can print, or I can send I can send an editable version. I'll send a Word document. Okay. Oh, Google Form. Perfect. Okay, so Victor is going to circulate it in a Google Form. So you click a link, you go in, you just fill it in, blah, blah, blah. That's also good for anonymization, because the Google Forms, although you use your Gmail account to access, it will be a Google Form or an Outlook, even better. Yeah. So it'll be completely anonymous. But as I said, the first component was really the most important part about it, I think, is just as a framework and to introduce these ideas that we want people to be thinking about. But it's also important to collect that information to see where people are. The more important part is I think it's section 2 or section 3, where we want to know how people feel about the ability to handle situations, what they think would be helpful to have further sessions on, what kind of format it should be in, that kind of thing. Yeah, and since you're doing it online, you are the place for free form entry. At least nobody can read your handwriting, so nobody can tell. Sawa. Any questions from the branches? I just looking at the chat. I should have looked at the chat when I was asking questions. I see I got Joyce's consent to tell that small story. And then Roslaire was responding to the definition of conflict. Conflict is a disagreement or argument between opposing forces, ideas, or interests. Yes. That usually when we think of conflict, that's what we think. We think there's like there's a negative charge to the word conflict, right? Yeah, it means that something bad has happened. But actually, the most simple definition of conflict is just the fact that two people don't see things the same way. Yeah, like if you have somebody who's colorblind and you look at a picture, and somebody who's not colorblind, they see that picture differently. Doesn't mean they're having a fight about it. So the definition that we're more used to, that Roslaire has given, is closer to that original slide, which I was talking about combat, right? Conflict is inevitable, but combat is not. Sawa. If there's no other questions, then I think we can close. Anybody? No. So please respond to that form. Because I wanted us to do it to get responses by the beginning of next week. We'll be able to have okay. So at some point this afternoon, a link will be circulated to fill in that survey. Please try and do it as quickly as possible, but by latest the start of next week, so that we can now see what we do next. So while we have everyone here, is there anything else that we need to communicate? Yes. Well.
So, as you know, this week we've been running the audit. So we expect the audit to be completed today. And then next week on Tuesday, we shall have the closing meeting whereby we get the findings from the lead auditor, who was Brenda. And just a clarification on our reports that we are typing from the referral lab. Let's stick to our format for reporting. That is results and then reference ranges. Do not bring reference ranges before the results. That's bringing confusion to the clinician. I've received several feedback on that. So if you are typing results, type the results, then you put the reference ranges at the end. Remember, the reason as to why DKL, they are putting it reference ranges, then results, it's for them to have their delta reports on their side. For us, we have our delta checks on our Speedia differently. So the reason as to why DKL, they are putting their reports that way is because they're tracking the delta reports for any client who comes on the other side. So put the results and then the reference ranges at the end. Yeah. If you are reviewing results and then you find someone did the other way around, that's part of review. Correct or send it back to them to correct the results. Otherwise, thanks, Dr. Ngai, for the CME. We expect the next session to be soon, and we are working together with Amos to have our CMEs CPD accredited, and also our trainings to be CPD accredited. Remember, for the CPD points, we have trainings that carry 3 CPD points. That is when you do just a general CME, and when you do a training, it's 10 CPD points. So when you are registering for the CPDs, please check that. Otherwise, for me, I wish you a good day and thank you for attending this meeting. The CME is recorded. It will be shared within the course of the day. Otherwise, I wish you a good Friday and a nice weekend. Thank you.